All right. Well, I think that we are good to get started. Thank you, everybody, for joining today for our event, Can Technology Solve Aging's Toughest Challenges? Hopefully, we will have an answer by the end of the day. My name is Kylie Meyer. I am an assistant professor at the Francis Payne Bolton School of Nursing, as well as the co-director of the University Center on Aging and Health. Co-director Eliana Rani is here with us today. We will also be running on Zoom, so if you see us over there looking at our screens, we are fully engaged, but also with our online audience today. So a little bit about the Center on Aging. The Center on Aging has been around since 1978. We are 48 years old. And if you feel like you have deja vu, we had a conference that was very similar to this topic in 2011. I was not here, but we had some great folks. I see our former director, Dr. Diana Morris. Carol Musil was here. Let's see. I know Peter Whitehouse. Peter, who told me he was the longest serving member of our Center on Aging here, too. So add that to his accolades. And so we're doing this again because a lot has changed since 2011. We're talking about AI. We're talking about companion robots. So thank you for joining us today. I want to recognize our partners, Benjamin Rose, as well as Judson Park, our Judson Senior Living. Benjamin Rose, of course, is a leader in the nation of innovative solutions to support older adults and family caregivers. And what a beautiful conference space. You really can't ask for a better spot to host. As well as Judson Park, who has been a longtime partner for CWRU and most recently testing out the RUI program. So we have a great team of people here, including some residents from the Judson community who will be telling us about their experiences. So this is actually a project that really deserves credit with Phil Cola, who is, let me pull up my notes. Everybody here has such long titles. I have to have my notes. So Dr. Cola is the, let's see here, Winkle Healthcare Management Professor. And on Monday, we'll be adding another chair to his name. And he will be showing us a presentation about the RUI project, getting us started for the morning. And then he's going to be joined by a panel, including Cindy Struck, who is the VP of Health Services at Judson, who will be sharing her experiences from kind of a staff and leadership perspective, as well as Susan Nadar, who is the Phelps Collaborative for Older Adults and Family Engagement faculty member from the Francis Payne Bolton School of Nursing. That is going to be facilitated by Dr. Erin Gentry Lamb, who is the lead the Humanities Pathways Professor at the School of Medicine, as well as the co-director for undergraduate bioethics. If it sounds like I'm giving you a lot of names right now, it's because I promised Erin that I would take on the introductions before the panel. So we're also introducing our first panel and kind of our morning session for today. That panel, as I mentioned, is going to be followed by a response panel from some of our residents from Judson. We have Art and Nancy Glendon right here. Great to see you, as well as Judith and Richard Cohen. So thank you so much for joining. Oh, there you are. Hi, guys. Great to see you. Had a great lunch yesterday with them, so we'll have lots to talk about. And as I mentioned, that is going to be facilitated by Dr. Peter Whitehouse, who is a professor of neurology and has secondary appointments in several departments across Case Western, as well as one of the founders of the Intergenerational School. I promise I'm almost through introductions. I do want to recognize the Prentice Foundation, and Dr. Carolyn Harmon still will be sharing a little bit more about that foundation and their role today. They are really responsible for getting us here today, those great gift bags, the lunch from Food for Thought, so thank you so much to them for their support. I want to welcome our online audience as well. This is a hybrid event. Some people are hybrid local, some people are national. When I was looking at who had registered, we have over 145 registrants today. So not just here in this room, we have people from Michigan. We have people from the University of Pennsylvania, from Cornell, from UTMB. So hello and welcome. We have some folks who are from startup companies, researchers, students, faculty, older adults, caregivers, health and aging service professionals. So really big audience here with us today. Welcome to all. Couple of logistical points. So if you are here with us today, the bathrooms are right outside, and then you'll turn right and then immediately left. If you are joining us from home, that's a you problem. All right. And I know here you might have a really big voice, but we're still going to use our mics to speak because we want to make sure this is a great experience for our online audience. You will be receiving digital materials at the end of the day. Actually, you will be receiving them probably early next week, if I'm being honest here. Those will include slides from the presenters who are able to share as well as some handouts. If you are online, we do have a Q&A. We will be monitoring that all day, so please bring your questions and comments. We welcome them. And then lastly, we have our CE disclosure. So we do have CEs available for nurses, 5.16 credits. We will have an evaluation at the end of the event today that you can fill out and receive your CE certificate. Whew, I need a glass of water after all that. All right, so with no further ado, I'm going to introduce Dr. Carolyn Harmon Still, the K. Tana Harvey Professor of Community Health, Health Nursing, and our Assistant Dean of Research.
Good morning, everyone. And good morning to those who are joining us online and from afar. It is a privilege to gather with so many dedicated individuals, clinicians, researchers, social workers, educators, and our community partners, and members who share a commitment to advancing health and well-being of older adults. You know, as the population ages, and it continues to grow, there is an urgency to address some of the complex challenges surrounding Alzheimer's disease, as well as cognitive decline, as well as lifelong brain health is what we're focused on today. So today's conference invites us to explore some of those realities, innovative approaches that may strengthen our interdisciplinary collaborations and community partnerships and engagements. And we share that responsibility for healthier and fuller lives related to brain health. So in honor of this, we want to recognize the Elizabeth Servants Princess Foundation for its extraordinary partnership with the University Center on Aging and Health. And thank you for allowing us to partner with you. The foundation's longstanding dedication to strengthening healthcare in Cuyahoga County has been just visibly present through the medical and surgical research, public health initiatives, as well as investments in hospitals and organizations to create a long life legacy to continue to elevate this region and beyond. The foundation has been dedicated to improving the hospital management and administration, as well as expanding access to quality medical care in underserved and under-resourced populations. And again, this aligns seamlessly with the University Center on Aging, as well as the Francis Payne Bolton School of Nursing at Case Western Reserve University. And again, we sincerely extend our gratitude for allowing us to partner with you. Thank you.
Well, good morning, and welcome to Benjamin Rose. My name is Orion Bell. I'm the CEO here, and thank you so much for joining us here today. We have a long history of partnership with Case Western Reserve University and the School of Nursing. And in one of those small world stories, the original chair of Benjamin Rose, and we have an all-female board, and we have always had an all-female board, was Julia Bolton, who was Francis's mother-in-law. So just, you know, there's just, especially in the aging space, it seems like we all know each other, and so just one more example of that. This is a great topic. I am not an expert in any of it, so this is the only time you'll hear from me today. But just a couple of thoughts as we go into the technology question is that, you know, technology is a tool, so it's not good or bad any more than, you know, the tires on your car are good or bad. They can be, it just depends on where you are with them. And as an organization that serves an older adult population, we approach the technology issues, one, in access, because many of our clients don't have access to high-speed internet, or they don't have access to a laptop or the device to use or things. And so just the part of the perspective is access and connection to community, which is always an important question in aging. But we also have some great examples within our work of how technology enhances and improves some of the work. I was sitting at this table here and someone asked about programming in Lorain County. And a great example of technology supporting our programs is we do a lot of caregiver support programs, outreach to family members who are caring for a loved one. And so many of those things are available over the phone, online, through a webinar, a variety of things in that space. And one of our current projects, and you may have seen spots about this on some of the morning health news shows and things, is we have a project called SHARE, which is about facilitating dialogue between caregivers and their loved one with dementia, so that you can include your loved one in conversation about their needs and their wants and their expectations at a time when that might be more difficult than it would have been before. That started off as something that was kind of on, like paper cutouts and flannel board kind of things, and now it's a tablet device thing. So just a very practical example of how, technology does do a lot of things to improve the quality of the service and the access and the availability of programming for people. Again, thank you so much for being here today. It's a great subject. You're going to hear from some great people. Enjoy the space and have a great day. We'll see you in a bit. Thanks.
Phil Cole, come on up. I'll get your slides ready. You're very welcome. Okay. Let's try it out.
Okay. Good morning, everyone, and welcome. Welcome to everyone that's here. Welcome to everyone that's online. My name is Philip Cola. I'm a professor in the management school and in the medical school at Case Western Reserve University. It's really a thrill to be here because I'm running into a lot of people that I worked with a long time ago and in different roles. I started at Case as a psychiatric researcher a long time ago, and that's when I met Peter Whitehouse. And in the middle of my career, I spent 20 years running the research office at University Hospitals, Cleveland Medical Center. It was called Case Medical Center back then. And for the last decade, I've been a professor in both of those schools. And I got this really cool opportunity to do some work on technology and aging. And I was approached to write sort of a pilot grant to the National Institutes of Aging through Johns Hopkins University. And I said, no, like, why would I do that? I probably got a 3% chance of that ever getting funded. And they kept twisting my arm, and a lot of people kept coming and saying, Phil, we'll help you, we'll help you. And so we put together a grant, and lo and behold, we got funded. And we got funded to use this robot to talk to people at the Judson retirement communities, to bring the robot in, to visit with those folks and see how people reacted to that stuff. So here's my awesome team of researchers that work with me at the university and with our partners. Some of them are here this morning. Of course, Peter's here. My colleague Josh Gerlich is here. Cindy and Susan are here from Judson. But we also, and Gio, my research assistant, is also here. And we have some other folks pictured that are with the Navigate company, which are the creators of the technology of the robot that we use. Case did not create that technology. I did not create that technology. My job was to see how people reacted to that kind of technology. Okay, so wonderful research team. I certainly couldn't be doing what I do without each and every one of these people, so I'm very grateful to them. But this represented this wonderful partnership between the company that had some technology and robotics, Navigate. They're in California. They have offices and employees in Pakistan and in China. The founder of the company is a gentleman, his picture was up there a minute ago, named Hugh Rashid. He was a a Doctor of Business Administration student at the Weatherhead School of Management long before I was there, but of course I met him, and we decided to partner on this grant that I never thought I'd have any chance of getting that we got. And then we needed Judson Senior Living to be a partner with us so that we could have access to potential participants and we could really try out this technology. So this really represents this amazing partnership. The grant, like I said, comes from the National Institutes of Aging, but it's through this artificial intelligence and technology collaboratory that's run by Johns Hopkins University, but there's also a center at the University of Pennsylvania and the University of Massachusetts. Our grant just happened to run through Johns Hopkins. Josh, Peter, and I were at a conference in Washington last week. Johns Hopkins Business School is in downtown Washington, D.C. It's not in Baltimore like I once thought it would be, but it was in downtown D.C. And we were presenting a little bit of the results I'm going to show you here in a moment. Preliminary results, we're still collecting data for the next couple of months. This is a video I'm going to play you to show you what Rui's capabilities are. Rui is the name of the robot there you see on the screen.
This is Jane. She's independent, full of life, and has lived a story that deserves to be told. As we age, it's natural for memory and routine to shift a little, especially when life gets quieter. That's where Rui comes in.
Jane, last time you told me about your first classroom in Pittsburgh. You said the chalkboards were too tall and the radiator made strange noises. Should we pick up where we left off?
Oh, don't get me started. That part came a little later. Let me think. Yes, it was the year they made me teach both math and music. Poor kids. My piano playing didn't impress anyone.
Sounds like a plot twist. Shall we add that to your story?
Absolutely. That chapter needs a title. The Year I Faked My Way Through Music Class.
With Rui, Jane isn't just reminiscing. She's co-writing her life story. Together, they're building a digital memoir full of laughter, milestones, and meaning.
How does this one end? Incomplete.
The Browns lost again. I don't know why I even watch.
That's why we stick with the Steelers, right?
Exactly. Once a fan, always a fan.
Want to play game day guess? Here's one from 1979. Can you remember what happened in this play?
Oh, wow. That was the year we won the Super Bowl. Let me think.
Rui shares Jane's passions and turns favorite memories into fun cognitive games. It's not therapy, it's friendship, and a great way to stay sharp.
Jane, I noticed you had a fall. Are you all right? Would you like me to call someone to check on you?
I'm okay, I think. But yes, maybe call someone just in case.
All right, I'll let the team know now. They'll be here shortly.
Rui doesn't watch. Rui looks out. When something happens, it gently checks in and only takes action if it's wanted. No recording, no surveillance, just calm, respectful support when it's truly needed.
Jane, I've noticed you've been drinking less water than usual. How about a little drink to stay feeling good?
Without wearables or apps, Rui notices subtle changes and surfaces early signs, giving staff a chance to act before small shifts become serious. For Jane, Rui is more than a robot. It's a thoughtful partner. For Judson and its residents, it's peace of mind, deeper care, and everyday moments made meaningful.
So that gives you a little idea of what our robot is capable of doing, how we envision it to be working not only with staffs of organizations like Judson, but also with residents of organizations like that as well. So we envisioned Rui, along with its developers at Navigatus, being a good companion. I think generally what we've seen so far in our data, it can be a good companion. It can be someone you want to have conversations with that sort of keeps you company when maybe no one else is around. There's also some individuals, though, that think, I can't really think of the robot being driven by artificial intelligence algorithms as somebody that I want to hang out with, right? That I'm going to have empathy with, right? That I'm going to have those conversations. But we also think that Rui can be a helper, reminding you to hydrate. I know I can use that on a lot of days, especially days when I teach all day, and then I get like my legs cramp later because I don't drink enough during the day, right? And remind you to take medication. Once in a while, I think we all could use reminders like that. You saw in the video when Jane fell, and Rui came out and said, Jane, I noticed you fell. Can I call someone? Wow, does that seem to be like the absolutely most important thing to our residents, is that when there's a problem, a companion like this turns into that helper, a supporter not only for residents in a retirement community or potentially later in a nursing community, whatever, but also for the employees of those organizations, right? We hear all the time how there's burnout and how there's difficulty recruiting the next generation of people to work in a retirement community or a nursing home. But yet, maybe the robot can be a supporter of them as well, and a guide to sort of healthy aging and being in independent living as long as you can before you need extra support. But I think that has to start earlier than maybe what we once thought it to be. Okay? So Rui is able to detect behavior patterns. It's able to learn your life story. It's able to be with you and understand that with you. Dr. Whitehouse was writing about those things 25, 30 years ago when we were working together in psychiatry. It's able to monitor activity levels. Have you moved enough today? Have you been up and walking? When you're walking, do you have good balance? Are you moving around well? It has these fancy depth cameras that it can sort of measure the movement that individuals are having. Now, in reality, that hasn't worked so great yet in our testing, because sometimes there isn't enough room for Rui to actually detect. Like if it was up here and it was looking out at each of you, there's enough space to measure movements if it was focused on one of you. But if you're in a residence apartment and you're kind of up close, it may not be able to actually see all of that. Okay, and that's some of the things we started learning. So it has to be able to adapt to the home environment in order to have social and those physical interactions in which it's measuring and monitoring different patterns. Okay, so phase one, real quick. We went out and we interviewed 42 residents of the Judson retirement community. It was awesome. Some of them are here today, and they have become friends, not just colleagues that interviewed with us. But we did 42 members across about 10 focus groups at all 3 Judson facilities. I have more data than I know what to do with, right? For any of you who have done qualitative research, right? I'm already in my head, it's like, oh, that's about like 6 papers I could write out of that. Then, as of yesterday, we just completed making 20 short visits, bringing the actual robot to each of those facilities and visiting with some of the folks that participated in the focus groups. Our goal was 20. We've now completed 20. We might slide in a few more if I have the grant funding. But they would go out and they would make like 2-hour visits with residents at each of the facilities. The last phase with the robot that we have to do is now we're going to do some extended visits with a handful of those people who have participated in the first 2 phases, maybe about 8 hours. Okay, see how the robot does. We're a little nervous about that. I have to have Stefan, whose picture was up there. He kind of has to keep an eye on that robot. Turns out it's top heavy. So you residents at Judson, if you have rugs on your floors, it doesn't do too well. But, you know, those are things we wanted to learn and we wanted to understand, and engineers can redesign that, right? The problem is historically people didn't come out and talk to people who would use the technology. That is what secured us an NIH grant. Because I said, that's actually really all I want to do is go out and talk to people and hear from the potential end users. We're also doing focus groups with Judson employees. We're almost done with those too. And then we're going to do focus groups with family members that the residents gave us their names and contact information. That'll be the last piece we have to finish up on. Okay, so we're actually getting towards the end. Very briefly, some preliminary findings. Privacy versus surveillance. On day one, the residents started telling me, Phil, I want this robot going around. What? It has a camera? It's filming me? Well, it's kind of filming the movements and taking measures. I don't care. Where does that data go? Where does that information go? Who gets that? Oh, well, I'm going to wipe it clean. Yeah, Phil, I know you're going to wipe it clean, but in the future, where's that data going to go? Who's going to use it? What if someone hacks into it and I've told it personal information, I don't know, about my bank account? Judy gave me that example just yesterday. But like I gave it my bank account number and someone hacks in and has that. Okay? So there's this worry about where the data goes. Privacy and understanding. Folks, generally this gets completely overridden, maybe not completely, but mostly overridden, that if it's there when you fall, that safety measure almost kind of limits the concerns about privacy and surveillance. Doesn't eliminate it. But a lot of it is, hey, this thing can go into the bathroom, because that's maybe where I have the biggest chance of falling. If I fall, life at our age sometimes is downhill from there. So that safety often overrides even those other serious, real concerns. But now we know that, and we can understand how to use this better, how to manage the safety and privacy of information, okay? But who has access? What are you going to do with it? How could I use this robot? How could it be helpful to me? Autonomy and independence. Amazing people at Judson. And a lot of times one of the first things I get is, hi, Phil, I'm 96 years old and I'm in independent living. And they might tell me that 3 more times. And I assure you, when I'm 96 years old, if I'm in independent living, that's what I'm going to lead off with too. Okay. Josh has to watch me half the time now. So I hope I get there too. But they're very proud of that. But literature and information shows us if we try to implement technology like this, and there's some cognitive decline already, that's going to be harder to use that technology. And you might be 96 and in independent living today, but what about next month? What about next year? Right? When does that change? So one of the data points we're really trying to figure out is, when do we introduce RUI to a population or technology like RUI? When do we introduce that? Right? Should it be for me now? Should it be for my research assistant who's an undergrad at Case, Geo? Should we be telling her she should start learning how to use a robot? Right? I don't know the answer to that, but what if we could pinpoint that just a little bit better than just assuming, well, you know, when someone's in their 80s, right? We're all different. We can't make those kind of assumptions. But if we can introduce it earlier, get people familiar with it, when they need it, it's going to be more valuable to them. It's also probably going to keep them in independent living more often or more frequently for longer periods of time. Think about the financial ramifications to that. If you stay in independent living longer, and need less care because you had a robot to help you, that's cost effective. That might be the next grant that I write, is really around the financial or health economics models of this, okay? Companionship and social connection, I've told you a little bit about this before. Some people love it. I can hang out with that robot, it's fine. It never forgets. That AI-driven memory is really good. It was, in that video, it was showing you a clip actually from the 1979 Super Bowl when the, it was 78 when the Steelers beat the Cowboys. Okay, it's showing you that that's a great memory for people. They're remembering that. They enjoy that, right? We've seen movies like The Notebook where you're really compiling their life story. This robot can do that and have conversations with you about it. Some people really love that. Other folks, not so much. It's a machine. It's not a thing that I can sort of feel for, okay? So people are different, right? We're all different. We might all react to that differently. So there's the potential for it to be a good companion, but maybe that's not the best for everyone, okay? And then, like I said earlier, this idea of safety seems to sort of override everything. I don't care if I don't like the robot. I don't care if it trips over my rugs on the floor. I really don't care. But if it's there when I do fall, if it's there when I'm constantly forgetting to take medications that I really need and it's reminding me, then I'm okay. Phil, bring it on. Figure out those financial models, Phil, so that we can have something like this. Maybe when we're in independent living, it's a community robot. Maybe as our health begins to decline in whatever way, physically, cognitively, maybe then we start spending a little more one-on-one time with the robot. We can build those financial models for what that might look like and for how we would really do that potentially someday when we iron out the challenges with the technology that I've learned about by doing this study. So those are the initial sort of findings, a lot more to come. I think we're going to jump into a panel, and Cindy and Susan and Aaron are going to join me, and we're going to have a little more discussion about this and hopefully leading to where you can have some questions for us. So I hope that was a reasonable introduction to what we've done.
Good morning, everyone. I think we're going to give Cindy and Susan a chance to each speak from their own perspective a little bit before we open it up to larger questions.
Yeah, I think what we wanted to share a little bit as the research was being brought into Judson, you know, kind of how just our team and others and our residents really reacted, and thinking a little bit about, you know, we want to be sure that the robot isn't a novelty. You know, again, I think pull it closer. Is that better? Okay, real close. All right, very close. We have residents that say, hold it like an ice cream cone. So I'll do that. So I think we wanted to be sure it wasn't going to be a novelty. Again, you know, the heart of what we do in senior living, I think, is our associates and caring for our residents. So wanting to be sure that this was going to be an extension, a tool, a way to help persons. So again, you know, there's so much technology out there. You know, we get calls every day, but wanting to be sure that we were thinking about this in a very deliberate and thoughtful way. So that was the so exciting part of this, is being able to actually research it, you know, bring it to our associates, our residents, families and caregivers, they're all very big partners in our success and important in supporting the quality of life of our residents. So that probably was key, is that all the things we were able to test and what Phil described are really important to us. They're things we think about every day, but we wanted to be sure that we were thoughtful. And this has really helped, because as we have worked with the robot, saw the reaction of staff and residents and had communication, we learned things and we're able to then bring it back to the engineering team where we'll be able to make improvements and, make it even more useful. So I thought that was one key takeaway.
Yes, what we also learned was basically that we have to kind of debunk the technology myth. I think we have a tendency to underestimate people, and we maybe not me, but other people may say the older that somebody gets, the less likely they are to know how to be tech savvy and kind of use these devices. That is absolutely not the case, especially at Judson. Our residents were very excited when we talked about Rui coming on board. They jumped into action, as they usually do, with these kind of research projects, and they are very tech savvy. I mean, they're sitting in their apartments, they're talking to Amazon, ordering things, using Alexa. They know how to use it. And so we just feel it's very important to kind of hone in on that and not underestimate, and know that our residents get it. And quite frankly, the rest of the population will too.
And then, the long-term intention would be that staff would be able to monitor some of the robot interaction with an application. And every time we talk about staff, we have to really think about amplifying what humans do best, right? They deliver care, and I use that in a general way because we have all kinds of persons delivering care at Judson, from clinical persons to dining to housekeeping, but we want it to be something that's going to be effective and useful. So every time our staff hear about innovation and technology, they're excited, but they're also like, okay, like how much work are we going to do? How much are we going to fix? What are we going to have to do to maintain the technology? So I think as we, are more forward thinking and we get through this, initial phase, is whatever we do, it has to be operationalized easily into the work that we do. It has to be a benefit, a help, not only for, the residents who might, use the technology, but for the staff who want to support the technology in its use. So, we have seen so much technology over the past couple of years be more burdensome than helpful. And so I think that'll be a really important thing as we, look forward, because again, if you would meet any associate at Judson, the first thing that they're going to say is that they value the relationship with that resident, above everything. And so they want to be able to do what they can to make that the best opportunity. So they're very accepting, I think, of things that will help that. And so that's going to be really important. And how we introduce it will be significant. I think that's all we have to say.
Okay, well, great. Well, I'm going to take the moderator's prerogative to ask a few questions of our panel before we open it up to a larger Q&A where the audience can also ask questions. One of the things I noticed in the ways that each of you talked about it is some different vision about what this robot might be. The companion or the tool? I think a lot of the design of companion robots has been generated by the market. Right? This is what we assume is needed rather than from user demand, which is why studies like yours are so essential, right? To think to what is it that users actually want. I'm wondering if any of you are willing to speak to, well, let me say, Phil, sorry, I'm never that articulate. Phil, you indicated that you noticed some resistance among residents about the idea that Rui could be a genuine companion for people. What do you think about this divide between companion? Could this be actually someone that residents have a relationship with, versus tool, right? Its utility. Do you think users want the companion, or is this an idea that's really largely coming from the market and from designers?
Again, Aaron, it varies by who that resident is, right? But I think in a very sort of hybrid way, good technology needs to be both of those things. It needs to keep you company, right? Even if that's not the way you see it as an individual. It needs to be that companion that in some sense you develop some trust with. Maybe not trust the way we trust each other as human beings, but that this thing is going to be there when I need it. This thing really is going to remind me to take my meds and to stand up and stretch at different points in the day. But again, for those people who, again, aren't feeling empathy towards a machine, right, it's often overridden like, well, I will tolerate this because I need this. I'm going to need this thing at some point. And when that day comes, it'll be there and we'll rely on it, we'll count on it. And see, that's also too a development of trust in a different way. And so I think really I leaned a little bit more towards the companionship in the beginning. It just Phil's own idea of it. And it really is a hybrid model. It can be both of those things simultaneously, and that's going to make it more readily adoptable by as many people as possible.
I would agree with Phil. I think as we age, I think it's so important to have relationships. So again, I think as the robots more part of everyday life, and whether it's with our associates or our residents, if it's successful, I think it'll just seem like another person on the team, so to be, so if we can think of it, we all, even on the team, do different things. Some of us are more the person that engages. Some of us may be more the clinical person that are hands-on, someone supporting in a different way. So even as humans, we support sometimes as companions, sometimes as tools. So I think if that robot in its best essence can be a little bit of each, and it's around and we're all familiar with it, it'll, I think, be a lot easier to have it serve either way. Some days it might remind me to take my meds, or it might help the staff determine someone's having, a higher risk for falls. And someday it might be just somebody I talk to. And so I think it'll be kind of a little bit of each.
Yeah, just to echo what Phil and Cindy were also saying, I think, the research is there. We know as we get older, we are really at higher risk for isolation and loneliness. And so it may look different, for each individual. Maybe for somebody, it might be that little reminder to take a medication might be helpful. It might be something that they didn't necessarily feel comfortable sharing with their son or daughter. Oh, I'm really forgetting to take my medications at home. Luckily I have this little companion here. Just for those little sort of day-to-day reminders. I teach a psych mental health clinical at Judson, and so I have the FPB nursing students on board in the memory care unit. And even though those residents are obviously, already, they have dementia, you can't underestimate the value of that engagement, even if it's just, it's not the technology piece, but that social interaction. It's very beneficial with the nursing students and the residents. Just that 5 minutes of, just doing something together, sharing a laugh, doing a puzzle. And so if we can bring the tech on board, and again, being careful not to replace human beings, but just add to it, I think we are really off to some great things.
Okay, thank you all. So I'm interested in following up on that point of human contact and staff. So this may be particularly for Susan and Cindy. In some of the earlier experiments with companion robots in long-term care, such as with the Pepper robot in Japan, it was found that the use of the robots actually required more staff time attending to the robots. So it didn't free them up to spend more time with residents or provide more care as it was originally anticipated. Certainly, we have new generations of robots. AI is making more things far more possible than before. But we heard, Phil, in what you talked about, that, Rui's top heavy, requires some watching if there's carpet, right? It needs attention in ways that may demand staff time. And Susan, you raised that as a concern that you're already aware of. I think one of the other concerns that people tend to have around companion robots is the idea that these may eventually, in the future, be so cost effective we'll need less staff, right? That this can be a way to hire fewer people in the end. So I guess I'm curious to hear all of you speak to a little bit more thoroughly to what you've seen so far about how incorporating companion robots might either affect what staff do in their position, or how much staff you have overall, right? Or what kinds of staff you have.
So, I know it's never going to replace staff, but I think it could enhance what persons do the best. So when you even talk to our staff who haven't really experienced the robot a lot, they start to generate ideas, thinking, well, if I have to go help a resident shower, or maybe I'm feeding someone or I'm helping them, could that robot engage two other residents while I'm doing something else? Could that robot walk, in my neighborhood where I'm caring for residents and just check on everyone and let me know if somebody needs something? So I think they start to think about how that robot could be incorporated in day-to-day work. I will tell you that whatever it does, it has to be easy. You're right. Staff can't maintain it. And it has to be something that's integrated into the current workflow. We all use electronic medical records. That's kind of the basis wherever you work. You have to have a way of, documenting the things that you do. And so you don't want to go in one place to do one thing, get an alert from somewhere else, have something else to look at. Persons get fatigued. They can't manage all these different things. So whatever it is, it has to be kind of integrated. So if I'm going here to look for alerts, or I'm going to this place to document, or I want to share a thought, it all has to be part of, what you do. And I think, as we think about just care and keeping persons independent, we want to make it easy, not only for those clinical persons who are sort of trained to use electronic medical records, but for other staff. There's dining, housekeeping, sometimes security that's involved with our residents. If they can jot a quick note, it does help the care team, keep residents independent, and it brings all the information together. So whatever it's going to be, I think easy, integrated, and, I'm not sitting there trying to hook it up to Wi-Fi, fix it, hold it so it doesn't fall over, because those things will be, that's what even if it's great, that's what's going to distract everybody, and then they're not going to adopt it. So.
I think, just to echo what Cindy said, I think we also need to incorporate a lot of IT in order to have the support to operationalize. So IT will be, as always, our best friends on board, kind of helping to manage these things. We always like to say we want to work smarter, not harder. And so we want to be able to use this technology without making it more burdensome for us. And like Cindy said, if you have to look at two different phones and you're getting alerts on one, but then, Rui is on another, like that doesn't work. So just making sure, but how could we keep less burden on a nurse? So a nurse may be working with somebody and she may not see that someone is trying to, do something they're not supposed to, maybe walk somewhere they're not supposed to. So maybe just like, having this tech on board so that they can kind of just For example, Rui might be able to keep everybody safe by making sure that they're not somewhere they shouldn't be. Maybe somebody's having a hard time getting around and shouldn't really be close to the stairwell. Things like this. Now, that would really, in my opinion, help and enhance what the nurses can provide and not really deter and take away from what they're doing.
Just want to tell you a quick little story. Day one that we came to, it was actually at Judson Park, just introduced the idea, and Cindy and Susan gave us the floor to have a discussion. I introduced it, and there were a bunch of residents. I think it was before a big meeting, but there were also a fair number.
We need you to speak in the microphone.
Okay.
Because I see people in front of me doing this.
Okay, thank you. Thanks so much. I'm trying. So we're at Judson, and we're just introducing the project. And sort of after that introduction, an employee came up to me kind of in private. I don't think, honestly, they wanted Cindy to hear. But they came up to me in private and they said, Phil, thanks for coming out. We appreciate that. I don't like this at all. It's going to replace us. And I said, I thought about it differently of augmenting what you do, and there's a shortage of people that work in communities like this, and maybe it could be helpful. But that was day one. The last focus group that we had with employees turned into what we call in the management school a design thinking session, where they didn't want to answer our questions anymore. They wanted to say, here at this point in what we do, this is where the robot would be good. And here, okay, then we go and we do this. And the robot maybe could have been ahead of us already setting that up for us and doing this. So it went from, a person saying, we're going to be replaced, to a group of employees saying, Phil, let's design this together. And Phil, that should be your next grant, is to design those workflows for nursing homes, for retirement communities, for outpatient units at hospitals, et cetera, et cetera. So that was over a period of about 6 months, how that thinking has evolved to that. They've way outthought me about how we can use this.
Thank you. One of the things that I hear just in your responses, again, speaks to just what it is we want these robots to do. Do they need to be capable of replacing staff, and that they can do the human interaction, that they can provide all of these things, et cetera? Or is it just the specific tasks that are really useful? Are we aiming too high in trying to design a robot that can fully move around, can do all of the things that it does? Does it need to do all of these things in order to be effective and valuable?
A big question in any focus group always is, Phil, can it do this? Or it's really, Josh is the great focus group runner in our thing. Josh, can it do this? And Josh's response is, well, you tell me what you want it to do. Chances are a great engineer or a technology person can get it to do those things you're asking about. But we're here to hear from you, not for us to tell you what we think it can be. So it would have a lot of capabilities. Absolutely not. You don't need them all, right? You just need some to be consistent, some to be trustworthy, that, again, when needed, this is going to do what we want it to do. And that 100% we can get there. We may not be there yet, but we can get there.
I would say the most important thing about introducing any innovation is reliability, because as soon as it doesn't work the way you intended it to work, then everybody's just like, oh, it's another bad thing you brought to us. So I think the thoughtful way we're getting input from residents, families, associates, we're testing it. We're not saying, well, here's a robot and it's going to work. I think that's going to go a long way, because it can build incrementally too. So we can get it to do two things really well and it works. Then persons will be, much more happy to add number 3 and number 4 and build incrementally. So I think I think we'll have nothing but engagement as long as persons have input. I mean, I think that's the key to any change is if you're part of it, you're going to accept it much better. But if you have no input, it's just going to be another thing we tried to bring to the table that nobody wants to do just because maybe it's great, but if they weren't part of it, they won't want to do it.
Right. And it kind of reminds me in a way of electronic health records. I may be dating myself here, but, you know, we used to chart on paper. And then when electronic medical records came out, we were panicking like, how are we going to do this? This is going to be impossible. There was a lot of fear. We didn't understand how it was going to improve what we were doing. But then when we saw that maybe we could have a seat at the table and sort of help, you know, we're going to be the end users of this. And then we thought, oh, well, it can actually do this for us, or it can actually look up something for us and make our lives more simple, right? We're still working on that, to be honest with you. I wouldn't say that's quite 100% perfected yet. But my point being that there was a lot of fear around it and we weren't sure how it was going to play out. And now look at us. We're obviously a lot better at it. So I think that there's really not much of a difference here. I think there's going to be fear, but if we can really empower staff and, you know, the nurses on board and say, you know what, you have a seat at the table. You tell us, like you were saying, what you want this to do and how this could make your life better at work. We'll be on board and get that going for you. And I think that's really the point.
Thank you. I'll pose just one more question for the panel, and then we'll open it up for everyone here in the audience and on Zoom. Phil, when you laid out some of the key themes or concerns coming up in the data, certainly in the bioethical literature around companion robots, some of the key concerns are about privacy and surveillance and autonomy and independence. And I noticed in the video that it was very clear to point out that Rui does not record, that Rui does not surveil, and that Rui will only act if the resident says, yes, I want you to call someone now. So I can see that those are clearly attempts to speak to people's worries or fears about these. Can any of you speak to what you think are the most important practices moving forward with a project to ensure privacy, to ensure autonomy? Particularly, I'll say, in the issue of autonomy, one of the concerns is that older adults may not have the technical know-how to control the robot themselves. I mean, do any of us actually know how to control the robot ourselves? That's a black box, right? So what can we do to ensure privacy and autonomy?
Well, so it'll come down to a bunch of management protocols. A governance protocol for information technology that, again, a first question is, where does all that data go that it is collecting, even if it's just my life story and not all the visual sort of cues, where's it going? And to be able to really answer that question, right now it's going very locally on a computer that's inside Rui that the researchers can control. But in the future, where is it going? You know, if it's the organization's robot, and again, maybe it's sending information to Susan as a caregiver, did the resident really want that information in that moment to go to the caregiver or not? Was that something they weren't ready yet to disclose? So transparency, governance, that anybody that uses the robot really has a good understanding of where the information's going and what it's being used for and over what time period, I think is critically important. Then from our technical folks and information technology folks, the safety and security of that data that I don't know how to do it. I'm not an IT person, but the safety and security of that so that it's not easy to hack into the robot in the future to recover personal information from individuals. That just, you know, that has to be part of the development. Make that as difficult and as challenging as it can be. But that's just like anything else. That is just like our bank records and things like that.
The only thing I might add is I think Phil said it very early on is everyone wants to be in independent living and stay as independent as long as possible. Every one of us here, if we asked, what your goal in life is, you'd probably want to be in your home or wherever you would like to live, but you just want to not have to depend, on others if you don't have to. So, I think of how we can, introduce, if the robot's effective, just like it's kind of a part of the team. So, I sort of envision it walking down the hall, saying hi to persons, beginning to just develop relationships. And it seems like another member of the team so that, maybe when you need something, the robot could be part of that, interaction and not necessarily a human. And there's things that, it might be able to help you with. But, I think of how many persons, when you wake up in the morning might ask Siri or Alexa, what's the weather for today? Do I have any appointments? Some people set it to remind them to take medications now, or maybe to, put a grocery list together. So we're already relying on technology to keep us independent and allow us to do things that are better, like things we want to do. If it's telling us, oh, you have to take your medicine at 9 o'clock, that's helping me think about something more fun I might want to do. So I think if it turns out to be that kind of a interactive technology, then it probably will be okay. But if it feels intrusive and it's monitoring and telling things I don't want it to tell, then, it'll be hard. So, I think the hardest part for, many of our residents, and I'm sure it would be us too, is that we're always afraid someone's going to interact with us or maybe find something out that's not going to let us stay independent. That's a fear of everyone. So I think if it can be just more of a positive, and the goal is to help persons stay where they are as long as possible, I think it will do nothing, hopefully, but extend that, not take it away.
I can just speak for, I know, remote patient monitoring is a really big thing now, and we have patients at home monitoring their blood pressures or fetal heart tones for, people who are pregnant. It's really, it's out there. And so, IT almost can't even keep up with it. I know the government, they do have some regulations in place now trying to, where is this data going? Who's receiving it? Are they allowed to sell it, share it, things like that? And so I know it's still a work in progress. Again, I'm not an IT expert, but from my understanding, it is that they are working on that. And then the other thing I just wanted to keep in mind is family, like family and friends, like, we all have each other to support. Whenever Alexa came out, I think we also had a tendency to say, what? This could be listening to me? What do you mean? How does it work? But you may have relied on somebody using it, and they sort of guided you through the process. And we can also do the same with family. We might be a little bit leery of it at first, but then when we kind of see how it can perform and how it can help us, recipe is going to be the next thing on my list with AI. I'm sure my family would appreciate. Please generate a recipe list so I don't keep making the same food every day. But, knowing how it can help you, and then also, looking to your friends, your family, hey, what did you think about this? I think we're all kind of just trying to navigate something new. We're all in the same position, but it could really work to our benefit.
I would like to open it up to the audience. There is a microphone here in the middle. If you're not able to go, I think we have someone who can bring the microphone to you as well with questions. Looks like we have one up here.
Hello? This one works. Are you raising your hand? This one.
Two questions regarding IT. Several years ago, I was with a client and we were talking about something regarding the sale of their house. And we were discussing something, and not 5 or 10 minutes later, Alexa answered with something pertinent to that. So that's something that's scary. And the other thing is, several times a week, I get a notice from Amazon that I have purchased an iPad and a telephone, and I have not. So that is scary. And several residents at Judson Manor, when I asked them what is their concern about Rui, that was one of them. My other question is, how did Jane get the pictures of the football game on Rui?
The idea would be there, Judy, that for Jane, the idea was that that was part of them recreating their life story together. Then Rui goes out with artificial intelligence to the internet and it pulls, okay, the clip of the 1978 Super Bowl, because that was a fond memory for Jane. And then in discussion, Rui can play those things back if that's what Jane enjoys or wants Rui to do. So again, that technology from a conversational standpoint exists now, and Rui could do that. We just haven't gotten that far with, residents haven't spent enough time with Rui to get that far, but if it spent weeks with you reconstructing your life story, it very well could just go pull things off the internet like that for you.
The second question's a bit more technical, I don't know.
That was about sort of data.
We need you to speak in the
The
microphone.
question was more about data security, and that sometimes you're in a room and you're talking about something, and then Siri or Alexa starts talking, and is she listening? And that would probably be more of an IT question. I'm not good learning.
That's probably not a question I can answer at the moment, but it is a question that's already out there long before we get to robotic technology. And it is something, I was in a meeting a few weeks ago at the university, and 5 people sitting around a table having a conversation. And in the middle of that meeting, somebody had probably an AI companion on their phone, just sitting over here. None of the rest of us knew that was on. And the AI companion answered one of our questions. And the person whose phone that was super embarrassed, like, okay, now they all know that in essence, I recorded this conversation because their AI companion answered one of our questions. It was very embarrassing for that person that was going on, and I don't know sort of the ramifications or how to deal with that yet, because it's all around us.
Hi, I'm Richard Cohen. I'm a resident at the Manor, and we were fortunate enough, Judy and I, to have Rui visit us and spend an hour with us. Dr. Whitehouse brought Rui, and we enjoyed meeting her. And I told Rui a story. I was asked, it was suggested that I communicate with Rui. And interestingly enough, Rui and I had an amazing conversation. Rui understood what I said, and she responded to my conversation. And it was an extraordinary meeting with Rui, and I just wanted you all to know that this is something that's extraordinary. I was blown away with this. I do have a question in regard to the one thing that I have seen with the residents at the Manor, and that is our memories are leaving us. I have a problem with names of residents that I might meet, and the next hour I have already forgotten. And this is something that is very common, and I wonder if Rui could help us with that great problem that we, the residents of, I'm sure all of the Judson facilities have the same problem.
Thank you for sharing your experience. Did anybody want to speak to that?
I think there's tools or ways to help improve memory. So could Rui be that person to do some memory work with you each day? I know we had met with another resident who said, I can't remember what I ate yesterday, but I could remember, 20 years ago very perfectly. So, there's probably things we could, we can have Rui do that would help with memory, because there are significant, I don't want to say games, but ways to interact that can improve memory. So it's possible for sure.
I'll just say, as a professor who can't always remember all my students' names, I would love to have a Rui whenever a student came up and said, "Oh, so-and-so has a question for you." That would be a great prompt. Who knows? Maybe Rui can act that role of interference for us.
I want to make sure, I didn't mean to interrupt. I'm representing our online folks today. So we had a quick question. I'm going to kind of combine two, which was, what if Rui witnesses a fall and there's no one around? And what would happen if Rui were to witness abuse take place?
What?
Abuse.
I don't, I mean, right now, and again, I think there's a lot of technology. If anybody changes plane, which is kind of falling, you're here and then you're not, there's technology that can alert us. I mean, I think we have to think about if the Rui's going to stay in an apartment overnight or is going to be with somebody during the day, we would hope that the resident who has that robot with them would certainly be amenable to that, because it's not any different if we have a caregiver with someone and, that caregiver observes a fall, they're going to call the team to help. So I think we have to probably make an assumption that it would, be able to help someone, would tell us that there's a fall, because I think that would be an intentional, part of it being part of that person's interactions.
Yeah, and so that first question is relatively easy to answer if you're in a community like Judson, because there is a protocol of what happens and who gets notified, and people are available. So that question might really come like if you're at home and you have a Rui, what do you do? And the one time a technologist kind of explained it to me like, well, Phil, like you have your alarm on the house, and if it goes off, you've already pre-programmed like a series of numbers for it to notify. And, the last one then being like your local police department to make a visit to your home. And it would be something like that. If you had that at home, you would pre-program like a decision tree, and it would just keep going down it until it got somebody that would respond to that. The second question is much harder. It's not something we've thought about in the context of what we've done today. I do think that is an ethical sort of question about abuse, and what if the robot saw that and what would happen. I don't know how to answer that.
I guess as the token ethicist here, I would think that point about autonomy becomes really, really important here. I would hope that Rui would have a chance to speak with the person alone, to ask if that's something that they would want reported. But I think when we talk about the trade-offs between, say, safety and autonomy, et cetera, sometimes there are trade-offs between abuse in intimate relationships and the things that still being in that relationship afford you in terms of life. And I think that is a decision that if a person is able to make that decision for themselves, that they should very much be in control of where their information goes or not.
Along the lines of autonomy, I have a two-part wish list. One is definitely as a caregiver, and the second is as a someone that has worked in a nursing facility. So my first wish list would be for Rui to have the ability to store an upcoming physician's appointment or dentist appointment, and then 2 to 3 days prior, provide a summary based on a set amount of time, so that physician can review a day-to-day basis of that resident or patient. As someone that has worked in a nursing facility, how does Rui help you with your charting? Are you able to download information to streamline your charting?
So we're not there yet, but the intent is that there was an app that would connect the caregiving team to Rui. Again, we haven't even worked through that. I also envision, thinking about just Rui during the day, like if I'm doing rounds, could I talk with Rui and it would chart as I go? I mean, one of our most difficult things is we have, weekly interdisciplinary teams. We do a lot of walking rounds on some of our neighborhoods. If we could record that information, as we walk around or as we're in a group, because we're all trying to concentrate, and so to be the note taker is always a challenge. So I look for it to be, kind of, maybe it could be an assistant in that way. That came out with some of our staff too, but we haven't gotten there yet. But those are things I think we could test.
Those type of things exist in health systems and outpatient clinics today, so that physicians or caregivers aren't having to chart. You have to notify your patient that, hey, this is running in the background and it's recording this. But it's going to save us time and it's going to be more accurate because it's really going to capture exactly what we said. So you have to disclose that. But that's operating today in I would say most health systems that I'm aware of. So that's already there. We just haven't told Rui to do those kind of things yet.
Hi, I'm Larry. I've been in healthcare my whole career, so give you some perspective. I home care, worked on Alzheimer's. I was an executive director of an assisted living community, and so what I'm curious about is as outcomes, have you made any influences yet of how it's going to affect health or happiness or operations? Have you seen anything that you can say, we should test this hypothesis with Rui? Because I'm a big believer in technology. I believe it's the cavalry coming over the hill for all us baby boomers, and it's really going to help us. So I'm just curious from that perspective.
I don't know that we've tested the hypothesis yet, but from coming in with a blank slate of residents, what do you think about this? We've now been able to formulate some hypotheses. And the first and most important one we've referenced here and alluded to is, will a technology like this, introduced at the right time, help people stay in independent living longer? I would love to test that. I believe that would be true, but we haven't really collected the data longitudinally enough to know that that's the way the outcome would be. But I feel really good that we formulated a question like that.
No, I think that's critical. And then, is it going to reduce falls in the community? Is it going to pick up depression? I mean, these types of things I think are very germane to what you're trying to do, because that's where the rubber's going to meet the road ultimately.
Yeah, we've definitely considered the idea of it observing behaviors over time that could show, maybe there is some depression that's now here that wasn't there at a period of time ago. That's already something we've asked that question. Again, we believe it would detect the changes in behavior patterns that we could start making or drawing some conclusions that maybe that's happening. Again, it's not spent more than an hour or two with people, so we don't have enough data to say, oh, yes, that worked, or no, it didn't. It's coming. I hope.
Sorry. Okay.
How about Kylie, and then we'll come back.
And again, I don't mean to interrupt. I just don't want our online folks to not be neglected. So one of our questions was about how would you imagine Rui might function differently in a private home setting versus in a residential setting where you've been testing it?
Having tested some technology in a private home setting, I think, it would have to be pretty good technically, meaning it's not falling over. You know what I mean? It's not pausing in its conversation. It responds to commands that you can share, because again, I think it's the reliability would be really important. And then I think the second thing is, again, if it's purposeful to, keep someone, safe or improve their quality of life, however you measure that, then there has to be some connection back to the care team where it could alert you that it's not working or that there's some support, because, nothing's worse than you have something and it doesn't work. We're all frustrated. You're trying to do something at 2:00 in the morning and it doesn't work, and then you can't fix it. So I think, there'd have to be some good support. Yeah.
When computers first came out, the mainframes were the size of a room. I would like to see, pardon me, a Rui type thing that's the size of an iPhone. Somebody could wear it. They could feel it fall. Somebody was falling, and just be a lot more convenient. And as far as having Rui as it is in someone's home, it would be very cumbersome because of all of the furniture and everything that would be in the way. So a small one would be great.
We have time for one or two more questions. Where was we?
So I will jump in there. So I just want to say two things. First, I would like to compliment the panel. I think this is amazing work. I also have a nephew that's graduating from Johns Hopkins on May 21st, and he's in the computer world. Whenever I tell people my nephew's at Johns Hopkins, they always say, oh, is he going to be a doctor? I'm like, no, he's in the computer world. So I put a note to myself, ask him if he's a part of this program. But anywho, I need to ask, so thank you for what you're doing. I imagine we're about 30 years away from this being something that could be for public consumption. I was literally thinking about the cell phone, and I Googled what was the first year the handheld cell phone came out, and it was 1973. And it was the early 2000s before it was out for public consumption. So I figured to myself, so this is a suggestion, and this is for Dr. Phil, if I may call you Dr. Phil, because I loved Dr. Phil. Dr. Phil, just for your next maybe iteration of your research, maybe the target audience ought to be people like my 32 and 26-year-old, because I'm imagining that this technology, I probably won't see it play out in my lifetime given my age, if there's anything to be said about how long it takes to move these things along. So that's one thing. I would love to see you open this marketing to a younger audience who actually might be really in the middle of this when this explodes. So I know if I had known about what this was really about, I would have invited my daughter to come today. Secondly, I want to say this, 13 years with the Annie Casey Foundation as a consultant. Now, for people that know about them, we do child welfare. I'm a 42-year child welfare person. And I can remember when we used to give about $5 million to each state, and my role was to lead the work in the state. And we always selected an urban area and a rural area. We never test piloted anything where we only did it in one community. And so my question to you, Dr. Phil, is will Rui be tested in an environment that is, say, and I love the work of Judson. I have a good friend that was a nurse that retired from working for you. But would it be like in let's say a CMHA facility of assisted living, to test it amongst very, very, very different people in terms of economics and even community support? So I just wonder, have you thought about testing it in very different communities of seniors that are aging?
Yes,
but that's it for me.
Absolutely, we have. That was really one of the very first things that was brought up to me when I started this, and I was very excited, and people are excited about what I'm doing. And one of the very first comments was, Phil, you need to test this in much broader populations than what you are, especially more variance in socioeconomic status, et cetera. So 100%, that would be definitely part of the very next study. And let me just address, I think that in the technology world today, there is an opportunity. This is going to move much faster than than the cell phone, but than what any of us really think. And that scares me. It feels like it puts a burden a little bit on me, not me personally, but people like me that want to make a difference in the world, that it's just like there's almost no way we can keep up with how fast everything's moving. So what it really says is I need a whole community of people, and they're out there. In Washington last week, the Gerontological Society of America is there, and all kinds of other groups, and they're saying, Phil, this is great, and we should do this, and we should do that. Well, I'm going to need every one of them to be doing those things, because it's going to move. It needs to move way faster than I can move it, or my team can move it. So it's going to take a big collective of people to do it. But I actually do think it'll move quicker than the cell phone. I really do, because it's just a different world today.
Thank you. Kylie, do we have time for the last? Okay.
I'm going to navigate away from the ethical to practicality. I'm in an area where we have frequent power outages, and I would like to know if Rui is a self-sustainable power source. Does she need to be recharged, regenerated like on 7 of 9 on Voyager? What does she need? And you know, when you've been in a power outage, you just pray that within the next couple hours, everything's going to come back to normal. And I'm just wondering, if somebody relies on Rui and the power goes out, does she stay with you for 8 hours, 10 hours, 12 hours? We run around trying to plug our cell phones in at South Franklin Circle. So I'm just wondering, how much power does she need?
She needs to recharge frequently. Right now, but again, remember the design thinking and the technology individuals, that wasn't their primary concern. Some people might say, well, it should be, but it wasn't their primary concern. So it's like a Roomba vacuum cleaner that needs to go off on the side and pause and charge. Okay, and when it's not sort of actively moving around, the idea is that it goes immediately to that charger, hooks up, and is charging. It doesn't even do that actually very well. And that's where then we need a human to be directing it towards the charging port. Kind of a scary thing. So it's not a self-sustaining source of energy or a charger. We did have some difficulty, Cindy alluded to it, hooking it up to the Wi-Fi at the Judson facilities. Even when we then switched from Judson Park to Judson Manor, it would not connect. And thank goodness Geo was there, my research associate, and she just walked by and she goes, no problem, let's hook it to the hotspot on my phone. And that's worked really well. But all those things that we thought would be easy and that, okay, it'll dock, it'll charge for so many, it'll charge for a little bit and then be good for so many hours. It's not doing that yet. But I also see that the technology folks, that was not their focus yet. They're going to get data from us that hopefully directs them in that way.
So I know we are past time. You're raising your hand. Is this a necessity or?
It was just an additional question to what she said. I was like, what about a portable charger? So instead of charging Rui, you could just charge the charger for X amount of time and then just like plug it into her.
I think we are at a fascinating moment of grand visions and immediate technological questions. Please join me in thanking this panel.